For more than 3 decades, Texas Health Resources has worked to break down barriers to health care for thousands of women in North Texas. Mobile health units travel to underserved areas to meet women in need where they live, where they work, and where they worship. And that's the focus of today's conversation with Lisa Rose, manager of Texas Health's Wellness for Life Mobile Health Unit program, and also Shanda Mayberry, one of the many women whose lives was changed because of a visit to one of these mobile health units. Thank you, ladies, for being here.
Thank you for having us.
Lisa, let's start with you. What are the mobile health units and how do they help North Texans?
The mobile health units are equipped with the necessary equipment. We have mammography screenings, we do cervical cancer screenings, and we take these buses out into underserved areas where women don't have access to health care, either because of transportation or finances or just lack of health care.
So when we talk about barriers, are those the barriers that are most common? Access to health care, lack of funds, transportation?
Correct, they are. And the women they're not getting the screenings they need. And so we found that by taking the units to where they live, as you said, work, play, and pray, they're accessing our units, they're getting their physicals, they're getting the necessary mammograms, so that if we do find something early, we can get them more treatment options, and they have a better outcome if they do get a diagnosis.
And Shanda, that's exactly what happened to you. You've been a nurse for more than 2 decades.
Yes, I am.
But yet you found yourself, I guess, with one of these barriers and accessing one of these mobile health units.
I did. Actually, I just started a new job. And so, that's one of the things. You don't want to take off work, especially when you start a new position and all of that. But I knew from being a women's health nurse and working, for more than 20 years how important that was. But I think we all get busy, whether it's work, as moms, as wives. Women get busy and put their stuff aside, and I did the same thing, but I worked for Charles State Hospital, and that was one of the things that they do is have the mobile bus come there. And so it was a perfect thing. I didn't have to take off work. It was right there. So it took away that barrier and that feeling of, okay, I don't have time to do this. It made it easy, made it fast. I was a little nervous because I thought, how do you do this in a bus? Because I had been in, fancy women imaging things and stuff.
Right.
But I was actually really surprised. It was very pretty, very welcoming. And now that I've been there and I go and try to tell everybody and, not to be afraid of that, and that they have, still the best equipment. Just because it's in a bus, it doesn't mean that you're going to have a different experience than you would if you were in maybe a hospital or an office or anything. And so that experience for me was life-changing, obviously. I went and had my mammogram, thought no big deal. It was so easy. And then you get your results on the app, which makes it really easy also, so you can get your results. One of the things that was really encouraging to me was they did follow-up calls and asked, how did it go? Made sure that I got my results. And then after I did get the results, they helped to make sure that I got the follow-up that I needed quickly.
Did you share the results that you got by going through this?
Sure, absolutely. So I knew as a nurse, when I started reading it, I opened it up, I thought, okay, I knew by reading, something was off. And so after that, I had to go through biopsies and do some different procedures to verify. Then they found out that I did have what they call invasive ductal carcinoma. So there's many types of breast cancer. I've learned more than probably I'd ever want to know about breast cancer now, but learned that there's many types of it. And I was very lucky. They caught mine early. And that's one of the things that's so important, I think, is getting women to go early and not put it off so that you have good outcomes. I found out, I guess maybe it was November of 2021 was when I had my mammogram. And then through the different procedures and the biopsies and all of that on Christmas Eve is when I got the phone call and found out that it was cancer and kind of what I was looking for. And after that, it takes time, to figure out, okay, what's your treatment plan going to be? You don't realize there's so many options, and then you have all these things you have to decide really quickly and all of that. I'm very blessed to have a great support system, family, even in the medical community, to get through that. And I think going through this process has made me even more passionate about taking care of women and children and making sure that they get the same care that I did.
Yeah, you're living
so,
proof that
yes.
these mobile health units that Texas Health Resources provides, I mean, it saves lives. And
Absolutely.
you have a personal story too, Lisa. Can you share that?
I do. Mine's a little bit different than Shanda's, but about 23 years ago, my mom was diagnosed with breast cancer. And as all moms do, they want their daughters to start taking care of themselves. Well, I was one that didn't have insurance. My husband at the time was not working, so we were one that were barely putting food on the table. And so healthcare wasn't a priority. And she would continuously ask, why are you not getting your mammogram? You need to have your mammogram. Go get your mammogram. You're of the age. And finally she just said, why are you scared of the test? And I said, Mom, I'm not scared of the test. I'm scared of what if they find something. What am I going to do? I can't pay for any kind of follow-up. I can't pay for treatment. If they do find something, I've got an 18-month-old baby. I can barely put food on my table. And she just looked, and she goes, but there's a program in Fort Worth. And she introduced me to Texas Health Resources mobile program. She actually drove me out to the unit, and she sat in the car with my daughter, and I went in and had my first mammogram on the Texas Health Resources bus. And I think that's one thing that's so important for these women in our community that don't have insurance or have financial worries. Our program is not just a screening program. Our funding covers the biopsies, the ultrasounds if they don't have insurance. We will get them to diagnosis. If they do come up with cancer, then we will get them into treatment and make sure that they get the care that they need so that they can overcome and get a good outcome.
I bet your story helps convince a lot of women to get on the bus and get the care.
It does, and I think the education, just, the fear of what if, because I think that's a lot of, people are scared. I don't want to know. I just want to ignore it. Why do I want to know? Because you're going to tell me I have something, but I can't do anything about it. Mm-hmm. But our program, as Shanda said, we follow up, we work, we talk you through it, we navigate you to the next steps.
Very different experiences. Here, Shanda was like, I don't have the time to deal with this. I'm a working mom. I got a husband, a wife, a job, all this stuff, kids.
Right.
But yet the bus saved your life. And in your case, Lisa, it was insurance. It was the barrier. It was money, and a little bit of fear too. That you talked about what happens next. I understand you're also helping women in homeless shelters. Tell us about this part of the program.
We are. For several years, we've been wanting to reach the homeless shelters. I went to a conference back in Pittsburgh a couple years ago, and I saw the impact that a mobile health care unit had in Florida. But they were providing the showers and doing laundry, and you could just see the faces of these residents when they would go into the bus and they would come out with their clean clothes and their fresh shower and their haircuts, and I thought, why can't we add the medical component? Because if they're feeling good and they're healthy, they'd be more apt to maybe make their circumstances change or go back and get a job or just feel better about themselves. And so we've recently partnered with Arlington Life Shelter. We've got our Salvation Army and our Daily Bread in Denton. And we take our units up there and we do a lot of chronic disease management. We, work with their diabetes, if they have blood pressure. We provide the mammogram screenings as well for the women. And we had I think in December actually, was our first time at Salvation Army. And we had a woman walk on the bus. It was the first time in 25 years she'd had a physical of any sort. And she's like, you were just a blessing. You were here today, and I was able to do this. She goes, I've been wanting to do this, but it's been 25 years.
Wow. Mm-hmm. Life-changing for her, too. Any final thoughts from either of you about, encouraging women to either get on the bus or be proactive with our health?
Absolutely. I've been through 5 surgeries, and it was a long process, and I understand that feeling of not wanting to know or being scared. There's been several women that have gone to the bus but then afraid to follow up and things like that. And so, even through the things I've been through, the challenges, all of that, I still feel very blessed to be here. I feel like there's a reason, and so for me, I'm just really passionate, want to help as much as I can to spread the word so that more women will go and get diagnosed early, because it's not just about the women. It's about their family. It impacts being able to take care of your kids, your husband if you're married, your family, your parents. It impacts everybody. So, women are kind of that hub for all the people. And so if they take care of themselves, then you can take care of other people. I know lots of people probably say the same thing I did. I don't have time.
Yeah.
But if you don't take care of yourself, you can't take care of other people. So I feel like I'm here for a reason. I'm cancer-free now, but I want to keep sharing my story, keep reaching out and encouraging women as much as I can. So we
Thank
can
you.
change lives.
Thank you for being here, Shanda.
Yes, thank
Final
you.
thoughts from you, Lisa?
Just know that our units and our programs out there, if you have insurance, if you don't have insurance, that we're there to help and take care of your needs. And, they can reach out and we can get them seen on our units.
All right. You've served thousands already. You're going to serve thousands more.
Yes.
Ladies, thank you so much for being here.
Thank you for
No,
having
thank
us.
you.